Sager. I'm going to be your nurse for today while we assess your abdomen. Can I have your first, last name, and date of birth, please?
Antonio Sager, July 16, 2002.
Okay, everything matches. I'm going to go ahead and wash my hands and follow with assessment. Okay, I'm back from properly washing my hands. I'm going to go ahead and ask my patient if he has any known allergies. Do you have any allergies?
No.
No allergies to any medication, environmental factors, or food? Okay, thank you. Now we will be assessing the patient's orientation. Can I ask where you are and roughly what time it is?
I'm in the bedroom. It's 11 a.m. Thursday.
Patient seems alert and very well oriented. Now we will assess the patient's general appearance. The patient is sitting upright on the bed, maintaining eye contact, seems in no acute distress, and appears stated age. Now we will go ahead and assess the patient's heart rate and respiratory rate. By doing this, we will assess the patient's heart rate for 30 seconds if it is normal, 60 seconds if it is abnormal. If the patient's heart rate is normal, we will continue for the rest of the 30 seconds by taking his respiratory rate. Can I see your arm, please? Within that minute in which I assessed the patient's heart rate and respiratory rate, his heart rate came to about 64 pulses per minute, equaling a normal rate with a grade of 2+, and his respiratory rate with 14 breaths per minute, also equaling a normal and adequate amount. Now we will go ahead and follow through with the abdominal assessment by having the patient lay down and fold up his shirt to which only his abdomen is exposed. Now that the patient has laid down, we will go ahead and start by inspecting the patient's abdomen as it is symmetric on both sides. No signs of any distension, flat, slightly scaphoid, and no signs of any lesions, discolorations, or any signs of any wounds from any previous injuries. After inspecting the patient's abdomen, I will go ahead and auscultate the patient's abdomen before we go ahead and palpate the abdomen, just so we don't cause any unnecessary bowel movements. By doing so, I will use the diaphragm of my stethoscope and start at the right lower quadrant. As I have found bowel sounds in the right lower quadrant, I will go ahead and assess the other 3 quadrants of the abdomen. After assessing all 4 quadrants of the patient's abdomen, you can fully say that there are bowel sounds and movements all throughout all 4 quadrants. After properly inspecting and auscultating the patient's abdomen, as we found signs of no discoloration or lesions with a hyperactive bowel movements, we will go ahead and percuss all 9 regions of the patient's abdomen. After successfully percussing the patient's abdomen, we can say that all sounds were tympanic and dull. After properly inspecting, auscultating, and percussing the patient's abdomen, I will go ahead and start with light palpations on the patient's abdomen to find any lumps or any tenderness or any pain that the patient might be complaining of. So once I press on your stomach in all 4 quadrants, can just let me know if you have any tenderness or pain. Okay, did you feel any pain?
No.
I will go ahead and continue with palpations with a deeper sensation. Did you feel any pain?
No.
No signs of any pain or any signs of any lumps that could mean any abnormal findings, leading to normal findings of all 4 quadrants of the patient's abdomen. After assessing the patient's abdomen, I will go ahead and inspect the patient for any CVA tenderness. By doing this, I will go ahead and locate the 12th rib of the patient posteriorly and slightly percuss around the area of where the kidney would be for any signs of any abnormal findings. So I will go ahead and percuss the patient's back and just let me know if you feel any pain. Any pain?
No.
Any pain?
No.
Okay, as no pain was indicated, we can go ahead and say that there are no abnormal findings, such as any kidney infections, indicating that there is no CVA tenderness. After properly assessing the patient's abdomen and providing and guaranteeing privacy, we can go ahead and ask if the patient has any questions before dismissing the patient for the day. Do you have any questions or concerns for me? Okay, I hope you have a great day. It was nice meeting you, and I'll see you for your yearly checkup.